Welcome to 2-Minute Anaesthesia in Critical Care. In this episode, we'll quickly explain how volume-controlled versus pressure-controlled ventilation and how this affects the shape of flow, pressure and volume curves. Let's get started. So let's start at the beginning. What is ventilation? Ventilation is the process of moving air in and out of the lungs to enable gas exchange. We're going to outline the basics of mandatory ventilation modes, i.e. pressure and volume modes. This is a rather complicated topic, so we'll discuss both pressure and then volume modes of ventilation. Each graph will be discussed individually. On the y-axis we'll have pressure, centimetres of water, volume in mils and flow in litres per minute. The x-axis is time in seconds. The red dotted line denotes inspiration followed by expiration. So now let's start with pressure controlled ventilation. So in this mode of ventilation, we set the inspiratory pressure. This is the peak pressure the ventilator will deliver, or the maximum pressure. As we discussed, this is denoted in centimetres of water. So the ventilator delivers this constant pressure during the inspiratory phase. And this is maintained throughout the inspiratory phase and thus produces a square waveform. As we set the pressure during this mode of ventilation, this reduces the risk of lung injury. Now let's look at the flow waveform for pressure ventilation. Flow rapidly increases, then decelerates as the lung expands. This is because the ventilator delivers a preset pressure, and as the lungs fill, there is a reducing pressure gradient causing the flow rate to also reduce. Now we'll discuss the volume waveform. As we've discussed, the flow initially starts high and then gradually decelerates as alveolar pressure equilibrates. This produces an exponential rise in volume rather than a straight line, as we'll discuss for volume ventilation. Once inspiration is complete, expiration is achieved passively via exponential decay back to baseline. Now let's discuss volume ventilation. So we set the tidal volume which we wish to achieve, and the ventilator will aim to deliver this. The ventilator delivers a constant flow square waveform throughout the inspiration before dropping back to baseline. During exhalation, there is reverse flow or negative flow before returning back to baseline. The airway pressure waveform shows a rapid rise in pressure followed by a plateau period before returning back to baseline. The pressure waveform is highly variable, with its shape influenced by multiple factors including lung compliance and airway resistance. This variability means the waveform provides valuable information about the underlying respiratory mechanics and the patient-ventilator interaction. And finally, the volume waveform for volume ventilation. As there's constant flow, this produces a linear rise with, as we've discussed, passive exponential decay. Now let's briefly discuss volume and pressure modes of ventilation. So in volume, we set the tidal volume. The ventilator will aim to deliver this tidal volume, however it may require high pressures and therefore risk barotrauma. Conversely, in pressure modes of ventilation, we set the pressure, and therefore as this pressure is not too high, this leads to a reduced risk of barotrauma. However, due to the lung compliance, this may lead to variable tidal volumes. Once again, thank you for watching.